Good morning. It's really an honor for me to join my voice and the voice of the 2.2 million members of our union, including the million hospital, nursing home, and home care workers that went to the bedside this morning to provide health care in their communities. It's such a privilege to be here with religious leaders, and significantly religious leaders from some of the key states whose senators will probably decide the fate of health care for all Americans, and who in the best tradition of their faith are standing up for justice and a health care system where every American who works can have quality, affordable health care. It's also a privilege for me again to join you as we did in President Obama's faith-based call, where all of us and 140,000 other people joined together to stand up for affordable health care. As we speak behind us, the United States Senate is going to make some of the most momentous decisions that people that work in our country have ever faced. And it may be too late for certain Americans, like Pat DeJong, a woman who was a rancher in Montana, the state of Senator Baucus, whose husband got sick, who did not have health insurance. He lost his life, and then they lost the farm that had been in their family for nearly 100 years. And it's too late for Ella Rose Pierre-Louis, who is a person from Florida who never had a chance to get health care, and at the age of 52 died in America simply because she was poor. Behind us are the names of people like Margaret, who's been waiting now for 2 months to be treated for a tumor, Guadencia, who has diabetes and liver problems but no insurance, or the children of Ray from Denver, Colorado, who are one illness away at an early point in their career from having a serious illness and ending up in bankruptcy. America can do so much better than it's done today, and we're here today to add not just our voice, but particularly the moral voice of all the people who stand behind me, who understand that a just and caring nation deserves affordable health care for every single American. That's the America we want. That's the America we need. And that is why we're here today, to be the moral voice for an America that ensures that work pays and that every man, woman, and child in our country can have quality health care that they can afford. Thank you very much.
Andy, thank you very much. Rob Rastusha from Community Catalyst.
I'm proud to be standing with you today. You're a wonderful organization doing amazing work representing the people behind us. Community Catalyst represents state coalitions in about 40 states, and we're with you 100%. We're here today to send a message, a clear message to our legislators. Health reform can only succeed if we deal with affordability for low-income people. Under the Senate Finance Committee bill, a family of 3 earning just $27,000 a year could be required to pay as much as $5,000 a year for premiums and out-of-pocket costs. These costs could force them to choose between staying uninsured and paying a penalty, or purchasing coverage but cutting back on other basic necessities such as food and child care. If we are going to require people to get coverage, it must be affordable. Requiring people to buy insurance that costs too much and covers too little undermines the goal of health care for all. The good news, and our report shows it, that Congress can make this right. The premiums and cost-sharing provisions in the Senate Health Bill are much more in line with low-wage workers who lack employer-sponsored coverage. We can make affordable health care for all uninsured Americans and keep it affordable for the country by projecting out some savings, and those are included in the report. Those savings including a public plan, $25 billion, requiring drug companies to pay the Medicaid rebate for duly eligible, $50 million, requiring employers to pay their fair share, $29 billion, including the Class Act, $58 billion, freezing the value of itemized deductions for those in the top 2 tiers of the tax bracket, $68 billion. These measures would generate about twice as much revenue and savings as we need to improve the affordability provisions in the Senate bill. We know that there is fierce opposition from some special interests to these provisions. Those who prefer the status quo and can spend millions of dollars protecting their bottom lines. Members of Congress have a choice. They can defer to these special interests and make health care unaffordable for low-income families, or they can stand up to the special interests and make health care reform work for low-income people. It's time for Congress to put the interests of working Americans ahead of the wealthy and powerful. The success of health reform counts on it.
Rob and Steve, thank you very, very, very much for being in this together with us. And now to hear what else is going on from Baton Rouge, Louisiana, my brother, Reverend Steve Beckham.
As Rob said, what we want isn't complex. It's fairly simple. Lower premiums, stronger caps on out-of-pocket costs for low-wage working families. Not only does this make good sense for the success of health reform, our own faith traditions are now also clear that this is the right thing to do. You look in the mirror and you ask yourself, what's right? I think it's a clear answer. It's right to protect those who are most vulnerable in our society. We do not stand alone, but we're here together. Not only do we have our allies from SEIU and Community Catalyst with us today, our event here is just one of many faith-based actions happening today across the nation in support of affordable health care for all of our families. PICO National Network, Faithful Reform in Healthcare, Interfaith Worker Justice, Catholics United, and the African Methodist Episcopal Church, amongst other faith groups, have organized over 50 rallies and events nationwide calling for health care reform. At 12 o'clock noon today, Faithful Reform in Healthcare will hold a National Day of Remembrance and Hope event at the National City Christian Church. There are over 30 other similar events taking place today across our nation, featuring interfaith services, candlelight vigils, prayer breakfasts, and other activities. Faith communities have organized the Congressional Call-In Day, expected to generate thousands of calls to Congress. Catholic United is running full-page newspaper ads in key states, including Maine and North Dakota. And later today, inside the Capitol building, PICO will be hosting a multimedia exhibit featuring 1,000 professional quality photos and video of Americans across our nation explaining why they and their families need health reform. Again, we hope you all can join us and ask yourself, what is right, other than we protect those who are most vulnerable? All of this activity is united and is focused on achieving the moral victory of making health care affordable for all families.
And now some closing comments from